This news is covering all angles of today's historic decision, including reaction from those local leaders who fought alongside President Obama for mandatory health care coverage in the United States. WPRI.com reporter Ted Nesi sat down for an interview with Rhode Island Congressman Jim Langevin today and joins us with more in-depth coverage.
Joining us now from Washington is Democratic Congressman Jim Langevin of Rhode Island, who voted for the health care reform law in 2010. Congressman Langevin, thank you for joining us.
Thank you, Ted. Great to be with you.
A major decision today by Chief Justice Roberts. What's your initial reaction?
This is a great day for America. This is an amazing day, a great decision on the part of the U.S. Supreme Court. Pleasantly surprised, of course, but with this Supreme Court decision, the majority has ruled in favor of ostensibly keeping the universal health care bill and the law intact. I was proud to vote for that law. It's so important to reforming health care in America, covering the uninsured, making sure that people can't be denied coverage because of a pre-existing condition. We're eliminating yearly and lifetime caps. This is exactly the vision that I have been fighting for, been working for since I got elected to Congress and over the last 12 years.
Of course, today's ruling also means it will become illegal for Americans not to buy health insurance. That's not popular. How do you defend that to people at home?
Well, you know, everyone needs health care at some point in their lives, and yes, if people were a bit sick before, they didn't have health care coverage, certainly they went to the emergency room, but it was probably the end stage of an illness, and it's one of the worst ways to treat people because you don't have continuity of care, and again, you're getting someone at the end stage of an illness. By passing the universal health care law and seeing it stay intact, people are going to be able to have access to a healthcare provider early on, so we're going to be able to focus on more early preventative care. Certainly that's great for seniors. They're also going to be able to get their prescription drugs at a more affordable price because we're closing the donut hole over the course of the healthcare law, and eventually we'll eliminate the donut hole altogether, so it makes prescription drugs for our seniors more affordable. And there are just so many aspects of this law. We're covering the uninsured. We almost had, it was approximately 50 million people that didn't have health insurance when the law was first enacted. That number, of course, has probably gone even higher since then. But now we're going to be able to make sure that we're stemming that tide, that all people are going to have access to universal health care coverage. So near universal health care coverage is the rule of the law of the land now.
Congressman Langevin, thank you for joining us.
Thank you very much.
Eyewitness News has more live and in-depth coverage coming up at 6, including how the law affects young people living here in Rhode Island. Plus, we have extended coverage online right now, including a question and answer with Lieutenant Governor Elizabeth Roberts on what's next for health reform in Rhode Island. All that and much more can be found under the Healthcare Ruling tab on our homepage of WPRI.com.